Vivek Murthy, our nation's leading doctor as the United States Surgeon General, has served three very different U.S. presidents: Obama, Trump, and Biden. As we continue to emerge from the COVID-19 pandemic under his watch, he is determined to make sure the country and the world focus on an ever-growing issue accelerated by that pandemic: mental health. At a time when suicide is the second highest killer for individuals between the ages of 10 and 18 in the United States, Dr. Murthy is focusing his time and attention on eliminating the stigma. And in this iteration of the Swift Hour, we talk directly to him about his plan to ensure we do not ever turn a blind eye again to the crisis that is mental health. I think when most people think about the Surgeon General, they don't necessarily think about mental health issues, which is something you are trying to change. Talk a little bit about that.
Yes, well, I think mental health is one of the most important issues of our time. Public health issues, but issues more broadly. Because it turns out our mental health is part of our overall health. It impacts our physical health, but it also impacts how we show up at work, how we show up in the classroom, how we show up in our communities, and for the people we love at home. And so when you look at it from that lens, you start to see that the numbers that we're dealing with right now in America in terms of the record levels of anxiety and depression and suicide truly constitute not just a public health issue, but a society-wide issue. And this preceded the pandemic. Certainly for many people, especially kids, COVID was tough, on their mental health and well-being. But when we look at the numbers, especially for our children, we see that suicide rates were skyrocketing in the decade prior to the pandemic, that nearly half of young people, high school students, are feeling persistently sad or hopeless. And these should concern us, rightly so. The good news is we know how to move forward and how to get better. We know that we need to invest in expanding access to treatment. That means training more providers and making sure that more help is available through the use of technology where people are. We've also got to invest in prevention programs, which we know work in schools and communities, but we're just not implementing them enough. So I'm encouraged that we're starting to see some of these investments move forward, but it can't happen fast enough. That's one of the reasons I'm focused on this during my time as Surgeon General.
There feels to be a bit of a stigma about mental health, which years ago might have applied to other health issues. How do you change that? How do you create an environment that make people feel more open to talk about mental health issues? Because, correct me if I'm wrong, at least I know the difference today versus when even I was growing up and how people talk about mental health is completely different.
That's right, and that's a really important point here, which is in addition to policies and programs making a difference, culture and stigma really matter. And for too long, people thought about mental illness as something to be ashamed of, something to hide. And that still persists today. Thankfully, among younger generations, we see greater willingness to talk openly about their struggles. And we need to do more of that, because right now, that stigma is preventing people from asking for help, even when help is available. And that's a tragedy. We can have the best policies and programs in the world. If people don't feel comfortable talking about what their struggles are and asking for help, all of it won't be, of use. So that's why, we've got to address stigma. The way we do that is by people standing up and sharing their stories, by people in workplaces in particular, creating a culture where we can talk about mental health and recognize that, look, this is no less important than our physical health. In the same way that we wouldn't be ashamed to talk about the fact that we sprained our ankle over the weekend and needed to go see a physical therapist, someone needs to get mental health care. If they need to take time to address a mental health issue that they may be dealing with, that's not a source of shame. In fact, I think of it as a source of strength, to recognize what your challenges are, to seek help so you can get stronger, you can be better. That helps you not just at work, it helps you at home as well.
What are you seeing, let's talk for a minute about the pandemic.
Yeah.
What are you seeing today in terms of, it feels almost as if we woke up and there wasn't necessarily a pandemic. All of a sudden masks weren't required in most places, even vaccination restrictions have gone away. Were you anticipating this sort of, what felt like this dramatic change?
Well, we certainly hoped, and I certainly have always hoped that things would get better over time, and they have. Compared to 2.5 years ago, when so much of this began, we are now in a place where, thankfully, people can gather with family and friends much more safely than before, where people are getting back to work, where nearly all of our kids are back in school learning in person, including my two children. This is a big deal, and it's happening with a much, much lower death toll than what we were seeing in the beginning because we've got vaccines that are remarkably effective at preventing hospitalization and death. We have treatments now that are also remarkably effective, and we know more about this illness. We have testing that's more widely available. So we've got to learn from the past, use all these tools to keep ourselves safe. I think one thing COVID has taught us is we can't take all of this progress for granted, right? If people stop getting, let's say they're vaccinated or don't recognize it's important, and people don't seek out treatment, especially high-risk people when they get sick, we may see the numbers go back up. But we have a choice there, and that's one of the reasons we're now, especially in that we have an updated vaccine available that's available for everyone 12 and up. We want people to go out and get that vaccine to continue and sustain their protection against the worst outcomes of COVID. That's how we will move forward. We've already come a long way, but COVID's still around, so we're not going to give up on or stop our efforts to really ensure that everybody in our country has the protection they need from this virus.
Well, thank you very, very much for joining us today and for being at the 2022 Concordia Annual Summit, and heard some incredible things about your session and the work you're doing on mental health, and we're glad that it's now become such a prominent part of the agenda and hope it continues to be so.
Well, thank you so much. I hope so as well.